Now it's time for our interesting quiz. I invite Dr. Vishwanath. He is interventional cardiologist, completed fellowship in adult interventional cardiology from KIMS Hospital, expert in complex coronary interventions and coronary imaging, joined in Apollo Hospital as an interventional cardiologist with Dr. Sanjeev Kalkekar. Over to you, Dr. Vishwanath. आप सबको को ज्वाइन करना है। हेलो 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 हेलो
Hello.
हेलो
Hello. Requesting all to just scan this QR code so that you can join the quiz. It's very interactive quiz. Your name will come up there. Please join the quiz.
Requesting all to come inside.
In such a large crowd, only 30 of you are joined. Please, all of you just please scan. It's just a basic quiz, not an advanced quiz, just for interaction and to understand the basic concepts.
Those who score better will get prize. Huh?
Okay. Should we start? Okay. 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 Okay, okay. If QR code is not visible, then you just go to slido.com, slido.com, and enter this code 3996764. Okay. So we will go ahead with our quiz. Okay. Coming to the first question. Timer. Just
बच्चा है तो मेरा.
famous actor from recent movies with famous dialogue, अरे बच्चा है तू मेरा, चला तुझे फंडा पिलाओ. Who is he?
Just answer on the mobile.
Okay. So 74% of the audience answered Rakesh Bedi, which is right. He is a Rakesh Bedi. This is a pics from recent movie Dhurandhar. So actual quiz start now. Okay, we'll go ahead. Okay. This right. So coming to the first question of quiz.
Back, one question back. That's
Yes.
So TMVR is commonly performed in native mild MR, degenerated surgical bioprosthetic mitral valve, acute MI, pericardial disease. Put on the mobile.
In the corner, we can see how many participants have answered this question. There is 37, 40. So 81% of audience answered correct answer. Degenerated surgical bioprosthetic mitral valve. Any comments, Kalkekar sir?
That's okay. They still want to use an acute MI. Just do angioplasty and acute MI. Don't do anything in this such patient. That is enough for such patient. Give Disprin, give Axer 2 tablets, give rosuvastatin, and send for emergency primary angioplasty. That is what is treatment for acute MI.
Okay. For a new audience, here is the scanner for that joining this quiz. and you can just join with slido.com with that code. You can scan this QR code. Okay. Going ahead. So, just we discussed 15 minutes back what is the primary mechanism of action of coronary IVL. How the IVL works. High speed rotational ablation, thermal plaque vaporization, sonic pressure or laser induced ablation.
So
Okay.
similarly for the lithotripsy which is used for renal stone, we use IVL for the coronary calcium. So whenever the coronary calcium is there, which is not able to clean with the routine balloon, we use the intravascular lithotripsy balloons. Yeah.
13% of you answered high speed rotational ablation. It is a rota ablation or orbital arthrectomy. It is not IVL. IVL is sonic pressure waves causing calcium fracture. Okay. This is third is the correct answer. So, next question. Which of the following is indication for cardiac resynchronization therapy, CRT? CRT is a latest device therapy in a patient with decompensated heart failure. So, which of the following is the indication of CRTD? All of the above.
So there is a 78% is very right correction. So what you are listen in the morning, you are not sleepy. That it suggests. So CRT is indicated whenever ejection fraction less than 35% with symptomatic heart failure. Indication that LBB, there should be LBB with QRS with more than 150. There should be persistent symptom despite optical medical therapy. So all of the above is the right answer. So all such patients nowadays should go guideline directed medical therapy of at least 3-month trial. If doesn't improve, then CRTD should be the option for such patient.
Yes. Main thing for CRTD is patient should have LBBB. That's the main thing. If patient is severe LV dysfunction and QRS complex is narrow, so then we don't do CRT. That's the one thing. Okay. Going ahead with next question. PCSK9 inhibitors are best indicated in. These are the latest molecules just introduced, that is injectable form of antilipidemic drugs.
Dr. Chadda has this taken very nice lecture on this part. Nagesh. Sorry.
All of the above.
So all of the above is the answer. 75% is good answer actually. So LDL more than 55, statin intolerance, and those who are non-compliant with the statin, these are the indication for the inclisiran. So first dose, then second dose after 3 months, and then every 6 monthly till the patient can continue. Next.
That's the advantage of PCSK9 inhibitor. They have injectable form and once a month or once a 6-month dose. That is a beneficial and well compliant. Okay. Orbital atherectomy benefits over rotational atherectomy. In which of the following? Calcium modifications have the main two atherectomy techniques. One is orbital, other is rotational. Which is a benefit for orbital atherectomy? Good.
Whoopingly 89%. I think I can happily retire now. Very nice answers. It's a large lumen gain bidirectional ablation is possible and better for eccentric lesion. I know some bias of all of the above will be there. Next.
Okay. Whoever not joined quiz, please scan this QR code and can join the quiz. Okay. First line therapy in obesity. What is the first line therapy in obesity? Pharmacotherapy, wrongly double pharmacotherapy, lifestyle modification, and GLP-1 agonists. Oh, 95 lifestyle modification. Everyone, yes, sir. Your comment, please, sir. Nowadays, everyone want the pharmacotherapy for obesity. Everyone want, in the era of Ozempic as Monjaro, everyone want to take that medicines. But first, you have to try the lifestyle modification. After that, only drug works. Okay. Next question, following are the indication for leadless pacemaker. We have a proctor for leadless pacemaker here, who have done more than 100 leadless pacemaker here. He will guide you. Which of the following is indications for leadless pacemaker? Okay.
Good, very good. So these are the routine pacemaker, conventional pacemaker. They have the battery, and these are the lead which are used for the pacemakers. And instead of all these things, one can reduce this to just these two pieces. These are the leadless pacemakers. These are directly implanted in the right ventricle and right atrial appendage. They're the same work as they do. So risk of infection is less. They are better as a cosmetically person can be more active. And they have limited, whenever patient has a limited venous access, they are much better, leadless pacemakers.
Okay. Next question. Best indication for drug coating balloon is it left main disease, small vessel disease, instant stenosis, or both B and C? DCBs are just recent advances in coronary interventions. Okay, both B and C.
So in left main disease, at least at present, do not use DCB.
The
So small vessel disease and instant restenosis, these are the present guideline indication for the drug-coated balloon.
As sir already mentioned, less than 2 mm vessel, we don't have stent for that. We have to put the DEB for that. And instant restenosis, already there is a metal inside artery. So we have to do just a DEB. Okay. Very nice. Okay. Coming to next question. Medical legal step before starting obesity drugs.
ECG, counseling and consent, lipid profile or thyroid profile.
Because these drugs are not just over-the-counter drugs. We have to just prescribe and start. We have to take care of certain things before starting these drugs.
Very right.
Right.
So lipid profile, thyroid is required, but what is most important, they should have counsel about the side effect of these medicines. Next.
Okay. Coming to next question. When to start anti-obesity drugs? Is it a BMI more than 25, 27, 30, or 27 with comorbidities?
So very good. So this is right answer. Both the should be there.
Okay. I think that both B and C wala bias. Yeah. Okay, we'll get ahead with next question. So, renal denervation is indicated in which of the following?
So resistant hypertension when person require more than 3 drugs. Second is the drug intolerance, patient not able to drug. And third is the non-compliance, patient not willing for taking the medicines. Very good, very good. Next.
Okay, coming to next question. Here's the ECG of the patient. What is the best treatment for this patient?
whether this person will require ICD or require pacemaker, will require mitra clip or beta blocker. The third lecture on pacing.
Oh,
So those who are on beta blocker, I think they should have one more T. So this person will require pacemaker. Heart rate, there is a 6 sinus arrest is there, 6 sinus syndrome is there. There is no R wave inside, no P wave and R wave there. So this is 6 sinus syndrome. Such patient will require pacemaker. ICD is not indicated. There is no any evidence of VT or VF, though ICD always contains pacemakers.
okay.
Mitral clip is required in only in those patients with severe MR. So nothing is there. I think still person are sleeping. Next.
Okay. So, correct answer is a pacemaker. A 70-year-old female with atrial fibrillation has a recurrent major bleeding and cannot take oral anticoagulant. What is the best stroke prevention strategy in this patient?
Stroke due to atrial fibrillation are very dangerous strokes. They should be treated with anticoagulant. But there are certain patients where we cannot give the anticoagulant. What treatment we should offer? TAVI is not indicated
Why
in
we will
patient
do-
with left atrial appendage. So what you have to understand, those patients with atrial fibrillation, 80% of the patient, the atrial fibrillation, there is a clot formation occur in the left atrial appendage. So if you close that appendage with the left atrial appendage closure devices, atrial fibrillation can be treated without anticoagulation. So lag device is the answer, correct answer for these patients. No treatment is not good. I already told it is dangerous. Aspirin will not work as anticoagulant. It is antiplatelet drug only. So lag device. So any patient with atrial fibrillation require anticoagulation. But if you are not able to give due to bleeding tendency or certain other reasons, we should go for a left atrial appendage closure.
Okay. So, what is difference between TAVI and TAVR? One of the common question which patient asks to physicians. One is surgical, one is percutaneous, one replaces wall, other repairs the wall. TAVI is only in Europe or TAVR is in USA. What is the correct answer?
और गंगाधरी शक्तिमान है.
Oh,
So actually गंगाधरी शक्तिमान है यही आंसर है. So TAVI and TAVR are the same thing. They are interchanging. One is the transcatheter replacement, another is implantation. Just interchanging terminology. So TAVI is not surgical, it is non-surgical only. Okay?
both are the same words.
No, there is no repair up or in both the cases it is wall is replaced only. Thank you.
Okay, next question. This was the interesting one. Okay. A 58-year-old male with prior MI is on statin. What is the recommended LDL-C target in this patient?
Now, no one should make mistake in this patient. Post MI patient LDL मेरा 100 के नीचे lab report 100 ही दिखा रहा है. मेरा normal एक नहीं patient पूछते हैं. They want that we should stop their statins. So what should be the LDL level in a post MI patients?
Main thing is post MI is very high risk category.
Act early, act faster, and LDL should be lasting longer. They should be kept low for a longer period.
Okay.
So it should be less than 55. Please understand this should be less than 55. I am not telling those patients who get recurrent MI. In that, this should be less than 30. But at least keep all patients with MI less than 55. Do not reduce statin in such patients.
Oh.
Next.
Weight loss drug with cardiovascular benefit is?
Our physician should be able to answer this thing. Orlistat, sibutramine, semaglutide, phenetramine. Earlier, Vimoda, Arni drugs, and now this weight-reducing medicine has changed scenario of medicine and cardiology also.
And it is a buzzing medicine
Yeah.
only. Okay.
Very good. 94%. Very good.
Okay. Nice, nice, very nice. So, primary indication for phenylfibratids is elevated LDL, elevated triglyceride, low HDL, or elevated lipoprotein A.
Actually, out of all the lipid abnormality, LDL is more dangerous. It is more associated with the cardiac stenosis, and triglyceride is more associated with the pancreatitis. So, what is the primary indication for phenylfibrate? Isolated hypertriglyceridemia, more is a phenylfibrate should be used for if the triglyceride more than 500 to avoid pancreatitis at first.
Oh.
Next.
So, compared to surgical AVR, transcatheter aortic wall implantation is associated with. There's a TAVI versus SAVR. Is TAVI has high early mortality? Is it have faster recovery, more surgical trauma, or longer ICU stay? What is the advantage of TAVI?
Very good, very good. So tower is associated with faster recovery and shorter hospital stay. We discharge such patient on next day or third day also. Many times we discharge after 2 days because bill is like 15-20 lakhs. Patient को भी लगता है 20 लाख लिया एक दिन में नहीं रखा. Otherwise we can discharge this patient on the same day also. Next.
Okay. Coming to the last question of this session. Ezetimibe acts by which mechanism? Inhibiting HMG coenzyme A reductase, increasing LDL receptor synthesis, blocking intestinal cholesterol absorption, increasing bile acid excretion. What is the mechanism? Oh.
So
Oh.
they act by blocking intestinal cholesterol absorptions.
Okay.
So that is the mechanism. So that is very safer medicine compared with the other medicines.
Okay.
Yeah, thanks.
So thank you. We will come to leaderboard. Kunal Patankar has answered most of the questions.
No, not
Dr.
eligible. He is a cardiologist and he has a speaker. Speaker are not eligible.
Yes, yes.
Next.
Dr. Sachin.
Sachin कौन है? अरे congratulations. ताली
Congratulations,
बजाओ.
sir. Sunny, Mohan, and Sai.
सनी कौन है? Very good.
Mohan.
Congratulations. Third,
Mohan.
Dr. Mohan.
Oh,
Which Mohan? Bankar. No, he
Oh.
is not allowed if it is Bankar. Very
and
good.
Sai.
Okay.
Thank you all. Thank you for such an interactive quiz. Thank you.
So now those who have not listened first 5 lectures, now they can listen next 5 lectures and can answer so that your answer will be more than 90% correct. One more quiz will be happen on the remaining 5 topics. Thank you. Thank you.
Thank you, doctors. Over to you, Dr. Vishwanath, for another interesting quiz. Please, jaiye mat, only 10 minutes.
Hello. This will be the fast quiz. So I request everyone to join this QR code. Please scan this QR code and join this quiz.
Please scan and join.
We will finish this as soon as possible.
It is interactive, so please join this thing. Only 5 people are joined.
Okay.
21, 27.
Nice.
Start after 50.
Yes. 33, 37. Nice.
39. जिसको भूख लगे उसने जल्दी ज्वाइन करना चाहिए.
Okay. Okay.
3 only. 2 more. 49. Half century. Good.
Okay. Wait.
Good. Go ahead. Start.
You can just
Start.
Okay. So we'll start with the quiz. So first, the fractional flow reserve helps to what? Measure the emotional stress, access functional significance, predict the operator's mood, and count the stent.
So lot of patients come towards you that one doctor is saying block is less than 70, another doctor is saying block is more than 70. So where you use FFR, fractional flow reserve.
Oh, 88% of the.
So FFR actually tells whether the block is significant or. So if you have bias with the two cardiologists, always ask to do the FFR. So it will give the technical error. AI in cardiology. This is also AI in cardiology.
And second thing, cardiologist doesn't count the stent.
Yeah.
We just put. Okay. Next. Okay. 55 years old male is recovering after uncomplicated myocardial infarction. He asks when he can safely resume his sexual activity. What is the best advice? Is one of the most common questions you get asked in OPD.
People don't ask. They ask very lately. So resume immediately after discharge, resume after 1 week regardless of symptom, resume after 4 to 6 weeks if clinically stable, avoid permanently. Very important question. I am happy that no one has chosen last week. Next.
Okay, coming to next question. It should be resumed after 4 to 6 weeks if patient is clinically stable. Okay. Which of the following condition is diagnosed by Apple Watch? Just last
STEMI,
session.
AF, LV dysfunction or diastolic dysfunction. One of the greatest benefits of Apple Watch is that it increase our practice by 10%. People come, sir, heart rate ज़्यादा बढ़ गया, कम हो गया. So at least whatever AI does, but this has increased our practice.
Okay. Yes, from the past seminar given by Dr. Kunal, is for detecting AF, it is FDA approved.
For STEMI, it is not accurate. If you are getting certain changes, you can do a regular ECG and then detect. LV dysfunction, diastolic dysfunction, not yet. Maybe in future it may come.
Okay, next. Just we discussed in with Shandesh sir, best graft for coronary artery bypass surgery is.
We cardiologists always try to defeat surgeon, but this is one graft which is not allowing us to win over them. And that graft is right radial, saphenous, left internal mammary artery or left radial artery. So if your surgeon is not putting lima, don't advise to go for surgery. Don't undergo surgery. So it is a lima.
But someone still thinks it is a venous graft.
So it is not, it is a left internal mammary artery which decides the success of surgery.
Okay.
Next.
Next. Okay. Best post-MI care is, what is that? Diet modification, exercise, antiplatelet, and smoking avoidance.
Dr. Shilpa has taken very nice lecture. It is the best. You have to select one.
All are
Whether
necessary.
diet, no, best you have to select one, I am asking. Whether it is diet, whether it is exercise, or antiplatelets or smoking avoidance. वेरी नाइसली भाई तू कुछ भी खा एक्सरसाइज मत कर स्मोकिंग चालू रख दे पर दवा बंद मत कर बिकॉज स्टॉपिंग मेडिसिन इज इक्वल टू सुसाइड स्टॉपिंग एंटीप्लेटलेट इन पोस्ट एमआई पेशेंट इज इक्वल टू सुसाइड सो नेवर स्टॉप एंटीप्लेटलेट सो फर्स्ट प्रेशराइज गिव फॉर द एंटीप्लेटलेट बाकी चलने दो बाकी थोड़ा बहुत ऊपर नीचे हो जाएगा
Okay. Coming to next question. Which of the following is not mineralocorticoid receptor antagonist? Is it furosemide, finerenone, spironolactone, eplerenone?
This is all AI, huh? Very nice. Its right answer is furosemide. Next.
Yes. Next. Coming to next question. Which of the following drug has shown mortality benefit in heart failure with preserved ejection fraction?
Lot of patients present with breathlessness, their Pro-BNP is high, but ejection fraction is normal. So they are called as a heart failure with pressure ejection fraction. And such patients don't have any treatment actually. There is one drug which is approved which helps in such patients. ACE, beta blocker, ARNI or SGL2.
Okay.
Very nicely. SGL2 is the answer. Next.
Okay. Coming to next question. Minimally invasive CABG avoids. Just now, sir discussed.
So just about minimal invasive in routine in CABG, they cut in the sternum. Minimal invasive, they cut in the left lateral in the rib cage, and that is called as minimal invasive. Misnomer, but it is a less. There is no cut on the sternum, so it avoids what? I told the answer also.
Yeah.
Let's see how many people are there to understand my clues.
Okay. Right.
Oh, 84. Still 16% are sleepy or hungry.
Okay.
Next.
Coming to next question. 4 pillars of heart failure with reduced ejection fraction includes all except.
So this is very, very important. You should know all these 4 pillars. If your patient with heart failure is not on this medicine, please start on these medicines. ARNI, beta blocker, SGLT inhibitors or calcium channel blockers. Which is the all except.
Oh.
Very nice. So calcium channel is not the strong pillar. Next.
Oh. Coming to next question. 60 years old male with erectile dysfunction is taking sildenafil. Which of the following drugs should be strictly avoided in this patient? Is it telmisartan, metronidazole, beta blocker or nitroglycerin?
If a patient who is taking sildenafil or tadalafil come towards you or now you want to start this medicine, which drug you need to take care? Answer this. Answer first.
Okay.
So it is a nitroglycerin. Always avoid nitroglycerin if a patient is on sildenafil. Next.
Okay. Screening test for silent CAD is recommended in which patient?
Dr. Amit Sangvi has taken just you have a CT scan or just you have a TMT. You should not send all the patient for all these tests. There should be some sense should be utilized. So which sense should be? So all patients should go for screening CAD. Hospital marketing will feel that all population should come towards you, but what is the medical advice that you have to answer?
Yes.
Very good, very good.
It should be undergone in selected high-risk individuals only.
Dr. Vishwanath has taken you to the school days.
Okay, coming to next question. A diabetic patient present with breathlessness but have no chest pain. ECG shows ST elevation MI. Why is that? Why is there no pain?
Patient is very brave. He is a strong guy. He doesn't feel that मर्द को दर्द होता है. Autonomic neuropathy or there is ECG machine error or pain is on the leave.
Okay.
कभी कभी रहता है मर्द को दर्द नहीं रहता.
Okay.
So very nicely.
Okay.
Autonomic neuropathy.
Neuropathy.
Very nice.
So coming to next question.
So all our mard are educated.
CAC score 0 is suggestive of
High risk, intermediate risk, very low risk or severe coronary artery disease. Coronary artery calcification. Very nice. So the percentage of right question are increasing. So I'm very happy that whatever you are taught or discussed, that is imbibed in your brain.
Coming to next question. AI in echocardiography helps to what? Increase in probe size, calculate ejection fraction, replace ultrasound or stop imaging. Dr. Patankar is not allowed in this question.
AI is not to for replace, it is to complement.
So it's right. So AI can help to calculate the EF through echo. Okay. Coming to next question. What is hybrid cardiac revascularization? Is it surgery plus thrombolysis, PCI plus surgery, surgery plus medical therapy, imaging plus surgery? Yes, it is, sorry, it's wrong. It's a PCI plus surgery. When patient is acute MI, we do plasty. After that, if patient has TVD, we subject that patient to surgery. It is a hybrid revascularization. Okay. So, beating heart CABG is called.
The beating heart CBG is called on-pump CBG, off-pump CBG, hybrid CBG or robotic CBG. बीटिंग हार्ट मीन्स दिल चलता है और हम अपन सर्जरी कर रहे हैं. Repair the motor without stopping it actually.
Shante sir is not allowed to answer this question. Okay. Is a off-pump CABG surgery which doesn't use cardiopulmonary bypass. Okay. Okay. So, drug proven to improve survival in heart failure.
Whether it is decoxin, which is told as a cardiotonic, or it is a loop diuretic like Lasix, or it is Arni, or it are nitrates. Which drug improves survival in heart failure?
Yes. We can give all of the medications, but that specific drugs improve the survival. It has changed the management of heart failure after it has introduced. Yes, it is RNA. After introduction of RNA, it has become very clinically important. High risk patient in post myocardial MI avoid sexual activity includes which patient post MI with
should avoid sexual activity. They include stable MI patients, control hypertension patients, unstable angina with decompensated heart failure patient or revascularized patients.
Yes, correct. Definitely in heart failure you can't do that. Okay.
Great achievement. So now only 2 questions are pending. Before that, I just do vote of thanks because I know nobody wait for that vote of thanks. So thank you to Vinay Selar sir and his team for the accepting our invitation and coming in large number. Thank you to Dr. S.V. Kulkarni and MEP Maharashtra which joined. Thank you to Dr. Dulera sir and IME team. Thank you to for all these speakers which are taken you since morning in a very elaborate discussion mode. Specifically Vishwanath, it's very good interactive things. Thank you to you. And thank you to all the chairpersons who are there. It's very difficult to get the chairperson nowadays. But they are there, they are available, they are seated and they are increase the interest. Thank you to all the attendees because unless you are there, we do not get interested. So जब तक गर्दी नहीं होता है तब तक मजा नहीं आता. It's like that. So thank you to all the attendees. Thank you to Sharo directors of all the Sharo Medical Care Foundation. Thank you to all the Cura Clinic staffs. And thank you to my better half, Dr. Shruti, my family, my son Sharo and my daughter Shranu for coming and allowing me to conduct such conference. It takes a lot of time and a lot of family time it is taken. Thank you to all of us. Now just small token of appreciation. Vishwanath has taken these questions very interesting mood. I just want to felicitate him by the hands of Dr. Vinay Selar.
Thank you, sir. Yes, thank you, sir.
Shruti madam.
Vishwanath also. You can come join.
I would also like to ask Dr. Sanju sir and Shruti ma'am to stay on the stage and felicitate Dr. Sangeeta Srivastava ma'am, who is our Master of Ceremony and past President of IMA. She has been energetic and enthusiastic to keep everyone awake. Now Dr. Sanjeev and Dr. Shruti will also felicitate Vaishnavi. Please. You have been tirelessly making efforts to make this ceremony a grand one.
And now I invite Dr. Nikhil Varje for token of appreciation. Dr. Nikhil is always a major support to our CURACON in all the series of CURACON. Very good speaker, very good support. Thank you, Dr. Nikhil.
रिमेनिंग 2 क्विज ऐसा ही करना पड़ता है, लोग रुकते नहीं.
Just give me 2 minutes only. Okay. So coming to next question. Best initial screening test for silent CADs.
ECG, TMT, ECO और CTCAG. In a moderate risk patients, huh? Very good. So coronary angiography is a very less risky test to be done. One test which should be done before CT angiography, two precautions. One, which test has to be done before CT angiography? Serum creatinine. Without that, they will not do. And which precaution you should take? Your heartbeat should be less. Many times you go to the screening CT room, your heart rate increases. So take Ciplar LA or beta blocker 1 or 2 days prior for CT angiography so that it will be done very accurately. At high heart rate, CT angiography is not accurate. Understand this part.
So
Next.
last question, just to appreciate all of you. You are listening since the last 5-6 hours to us. Thank you all.
So who was the player of the tournament in this year ICC T20 World Cup? Jasprit Bumrah, Sanju Samson, Shivam Dubey, Virat Kohli or Dr. Vishwanath Marshivanikar?
Yes.
Very good.
Jasprit Bumrah was player of the match. Okay. Coming to leader.
So Nikhil Varge has scored. So it is an insider information to him. So we will not consider as a winner. Dr. Karan Kale. Keshav Kale must be there. Who is Karan Kale? Very good. Congratulations, sir. Dr. Sandeep Gutte. Very good. He is marathoner in OPD. Dr. Satish Jagdale. Very good, sir. So those who are winner, they are allowed to take a meal. Next, last slide. Last answer. Please give your feedback. The questions are, one or two questions are there so that we will understand what things you want in the next conference. Every year we conduct, next will be in April 2027. So what are changes you want to do, which things which you like, just give this feedback. And requested all of us to join for the lunch. We are very sorry for the delay. Thank you. Thank you, everybody.
You can give feedback on the same Slido poll. Please, everyone, share your opinion. Thank you. Thanks a lot.